My name is Zvonimir Krajcer. I'm an interventional cardiologist at Texas Heart Institute. Abdominal aortic aneurysm is a bulge in the abdominal aorta due to weakening of the aortic wall. The abdominal aortic aneurysm typically forms just below the kidney arteries and may also involve iliac arteries that are located in the pelvis. The likelihood of having an abdominal aortic aneurysm is increased if you have family history of aneurysms, history of smoking, elevated cholesterol, high blood pressure, and obesity. Abdominal aortic aneurysms are commonly found in men over the age of 50. The abdominal aortic aneurysm tends to grow over a period of time, and once they reach 5 centimeters in diameter, the risk of rupture increases rapidly. The rupture of the aorta leads to serious internal bleeding and frequently causes death before it can be repaired. Most of the patients with abdominal aortic aneurysm do not experience any symptoms until the abdominal aortic aneurysm ruptures. This is why this condition is called a silent killer. In a lot of instances, the diagnosis is usually made accidentally on the X-ray of the abdomen or a CAT scan that's ordered for some other reasons, for some other conditions. For a long time, the only treatment available was surgery, which was performed typically in the hospital under general anesthesia and required a large abdominal incision, required also clamping of the aorta. This procedure is very painful, requires prolonged hospital stay, and is frequently associated with several respiratory, intestinal, cardiac complications, particularly in elderly and patients with heart conditions or lung disease. Since 1970s, a significantly less invasive procedure was introduced that is called EVAR, or endovascular repair of abdominal aortic aneurysm. This procedure can be done without general anesthesia, without abdominal incision, and is typically done via femoral artery introduction of a stent graft that can exclude the abdominal aortic aneurysm as effectively as surgery. This procedure is particularly beneficial for individuals that are at high risk for general anesthesia, such as patients with various heart conditions and or lung diseases. If you are interested in any additional information or you would like to schedule an appointment, please contact the Texas Heart Institute Center for Cardiovascular Care.